The year 2020 is a year that will not be forgotten in a hurry, more so with the coronavirus pandemic, which almost defined the year. Covid-19 is a unifying experience for millions of people across the world who have had to collectively play their parts in combating the spread of the virus. Lockdown became a popular word across the world. The containment measure implemented by the governments around the world to mitigate the spread of COVID-19, the imposition of stringent restrictions on travel, social interaction, and access to public places. These measures are all efforts to slow the spread of COVID-19, which has infected millions and have impacted just about every aspect of life this year. There were speculations that the virus was created to depopulate the world, and issues about the vaccines, which people in Africa are rejecting based on trust issues against the WHO and other stakeholders.
The idea of COVID-19 vaccine coming to depopulate the world is just an irony, because in the first instance, COVID-19 actually came to depopulate the whole world. Because looking at the number of casualties, deaths recorded all over the world, is a storm of depopulation. I'm going to say categorically that before WHO, World Health Organization, can approve that people of the world can access a particular vaccine, it must have been tested, proven, administered on some people over and over and over before it will be recommended across the world that people can take it.
People took to using home remedies to help coronavirus patients as well as its prevention. Some of these remedies are ginger, garlic, turmeric, lemon, and bitter kola, among others.
All these homegrown solutions are still being investigated in some institutions in Nigeria. The COVID-19 task force in Oyo State is aware of some groups of people in the University of Ibadan that are working on some of these things.
It is not, we keep saying it is not medication. It is not prescribed by anybody, but it's something that we take that can boost our immunity. Even without COVID-19, people that fall sick regularly, people that know that their immunity, happens to be low, they can take garlic, they can take ginger, so as to, build up the immunity of people.
Is Nigeria carrying out any research in combating the spread of COVID-19? Or is there any breakthrough in the vaccine curbing the pandemic?
The task force is eagerly waiting for a response, something that will tell us exactly what has been found, perhaps the efficacy of those herbs or other things that will be able to perhaps be communicated to people with the hope that it would reduce the chances of people coming down with illness or also ameliorate the side effects.
It is hoped that the vaccines, if any in Nigeria or across the globe, is found effective, will be made readily available and affordable globally for the use of all, and thereby get a drastic reduction or eradication of the virus. This is a collective responsibility for us all.